Good morning. Am I audible?
Yes, sir.
Great. We are starting with prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों के जैसे पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We introduce to a great master, Samuel Hahnemann, for this divine science and taught us dare to be wise, seeking blessings from our Guru, Dr. Prafull Vijayakar, sir, who made this divine science and connect with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay. So friends, we are in the journey of reading Organon of Medicine's practical part along with the fourth book of Dr. Prafull Vijayakar, sir, the Verbatim, the Mahabaleshwar workshop conducted in 2002 with the team Predictive. So up till now in Organon, we have read about the case taking part, and in case taking up to 91 aphorisms, we have read some instruction given by the master Hanuman that you should not ask the leading questions. You should observe the behavior of the patients. And in 91 aphorism, it was written that in a chronic condition or a chronic patient, when the original symptoms is not there, so you should leave the patient with a few days of a placebo and then allow the patient to develop the original symptoms and then you take the original symptoms. What is the wisdom of Master Hahnemann telling us in aphorism number 92? But if it be a disease of rapid course, That means in acute conditions, what we have to do. And if it is a serious character, admit no delay. That means in emergency, the physician must content himself with observing the morbid condition. So we need to observe the morbid conditions, alter though it may be by medicines. So sometimes it is because of medicine also. If he cannot ascertain what symptoms were present before the employment of the medicines, in order that he may at least form a just apprehension of the complete picture of the disease in its actual condition, that is to say, the conjoint malady formed by the medicinal and the original disease. So you have to take all the symptoms of the patient as well as after the medication what the patient has developed, which form the use of inappropriate drug is generally more serious and dangerous than was the original disease, and hence demand prompt and efficient aid. So that is what we have to understand. So because in acute conditions we need a prompt and efficient aid, and by thus tracing out the complete picture of the disease, he will be enabled to combat it with a suitable homeopathic remedy, so that the patient shall not fall a sacrifice to injurious drug he has swallowed. So I am sharing one of the case in regard to this is a case of one of my friend, Dr. Nishan. In this OPD, one small boy came with the changes in the behavior, and his behavior was changed suddenly. So he accompanied with the father, and father is telling that his behavior has been changing since afternoon. So Dr. Nishant was advised what happened in the morning. So he said that he went to ophthalmologist for eye checkup, and after coming from the eye checkup, his behavior was altered, and he is in a condition of delirium. So everybody is understanding that something is happening, something is happening. So our doctor asked the questions, what will happen during eye checkup? So he said nothing. Doctor has put some eye drops into this, and then everything is okay. The doctor says no worries about that. His eye is okay and everything, and everything is fine. So after that, it is something that the behavior has been changed. So that is something that the employment of the medicament, that means the atropine drop, which was put into eye for the dilatation, and after that atropine drop, his drop has absorbed and went into neural system, and then he developed delirious conditions and behavioral changes. So this is something that we need to antidote something. So here he antidote the atropine to atropine, antidote to atropine or a belladonna, and he prescribed opium to the child, opium, I think in a higher potency, whatever 10 m, and he was called that report me in the evening. So the patient came in afternoon OPD almost at 12:30 or 1 o'clock. So the patient reported in the evening and his behavior was normal. So this is what you have to take a conjoint malady sometimes, and or sometimes you need to understand what is the employment of the medicine can produce a disease. So this is what you have to take into consideration, especially when the disease of a rapid course or of a serious character. Okay. Aphorism number 93, if the disease has been brought on a short time or in case of a chronic affection, a considerable time previously by some obvious cause, then the patient or his friend, when questioned privately, will mention it either spontaneously or when carefully questioned. So this is what whenever you have an acute disease or you have a chronic disease, you need to you need to ask the cause, and that has to be find out. Sometimes you need to ask in private also. So that is what someone is asked the question, can it be considered a proving symptoms? No, it is not the proving symptoms. It is a crude form of atropine corpse as given. If it is in a dynamite form, then the patient develops symptoms, then it is a proving symptom. Okay. But but it is the medicinal aggravation, and those are susceptible to that. They only develop certain symptoms of this. If they are not susceptible, then they will not develop. So this is keep in mind that if the person is susceptible, then and then they develop symptoms. But in this aphorism, what master is saying, you need to find out the cause from the patient or from the payer, friends, and sometimes you need to, sometimes the patient give you cause spontaneously, or sometimes you need to ask questions very carefully in a private, so that they will guide you about the cause and effect relationship. So, what are the causes which patient is not giving you spontaneously? So, any causes of a disgraceful characters which the patient and his friends do not like to confess, at least not voluntarily, the physician must endeavor to elicit by skillfully framing his questions or by private information. So this belongs to some cases of the poisoning or attempted suicide. The patient is not willing to give you the answer initially, or sexual indulgence or onanism in ordinary or unnatural debauchery, or excess of stimulant desire like a wines, a cordial punch, and other ardent beverages, or a coffee, or overindulgence in the eating generally or in some particular food of a hurtful characters, the infections with the venereal disease or each unfortunate love, jealousy, domestic infelicity, worry, grief on account of some family misfortune, illnesses, spark revenge or injure pride, embarrassment of the pecuniary natures or superstitious fear, or a hunger, or an imperfection in the private part, a rupture, a prolapse, and so forth. So these are the some of the causes that patient is not giving you spontaneous detail. So you need to ask about a certain skillful framing questions, and then you take the history in a private, so that the patient is giving you an idea about something, and that is what the thing is. So here I will share one case of a female came to me uh, having urinary tract infections, and she had a burning micturations, and she said that I need to pass frequent urination over the night. So I asked what happened day before or 2 days before. So she said nothing, nothing, nothing. So I asked, something is happening in your territory or in environment, so that you are marking the territory. This was my question. So she said that actually the lady is working in some hosiery shop, and his shop, she is selling hosiery garment for the ladies and gents. So, in a market area nearby my clinic. So, what happened? Some of the vendors of hosiery, which was selling this hosiery in front of her shop. So he said, since 2 days, the one of the vendor came and he used to sell in front of my shop. So I used to have an insecurity about that. My business has been reducing. So she was jealous of something. So on the basis of that, I took a ailment from jealousy and the urinary tract infections. I prescribed Apis 1M to her, and within 3 days, everything went normal. So this is what something that you have to ask certain questions by naming skillfully. So this is you have to take into consideration. So again, we are reading the source book, the Verbatim, the workshop conducted in 2002 by Dr. Prafull Vijayakar at Mahabaleshwar. So we are reading these books, and we have in the last weekend we have the approach of the skin disease. So in skin disease, there are some handy tips which was given by Dr. Vijayakar sir, so that we can apply this. In our practice, so that we can get a wonderful result, or even we can assess the follow-up in a better sense. So in case of psoriasis, when the hypopigmentations remain for a longer time, Mind well, your medicines may be acting similarly, but not the similarly. So you should be very careful about that. Either it may land up or sometimes it may recur again. So by looking into this, you can understand that how the follow-up can be assessed. Now we are reading further the chapter 10 by Dr. Prafull Vijayakar. So we continue our journey into interior of the man. The miasm can be seen in each and every sphere of the body. Nature talks and shows miasm. Therefore, Harrison's Davidson talk the same. We have to understand and assess and learn from the way the body is expressing the differences. So we must understand, and we are helping the body to cure. We are not curing. This was written by the Kant in his repertory preface. This is written very nicely in the first few introductory pages of Kant repertory. He says, remember our medicine does not cure. It is the man who cures himself. We just stimulate man's defense. We do not need to stimulate again and again. Suppose there is a child and he is not listening to you and he has come with the dirty shoes in a drawing room and climb on your new beautiful sofa. What will you do? You will either scold him or tell him, please go away and do not do this again. If he does it again, you will go and slap him once. So I am pushing him and giving him a stimulus not to do anything like this again. Now this child with one slap understand that he should not do this again. Is it required on your part to go on slapping him again and again? This child says, I am not being given a chance to react. He says, yes, Papa, I have understood. Give me a chance to keep my shoes. You are just going on slapping me. If there is a recurrent stimulus, the child gets annoyed and takes his own hand and gives back. This is exactly what happens when we give repeated stimulus. I do not say that you don't have to, but there are ways and means. At least wait for a result of a stimulus. At least try to understand what is happening in the human body. See whether the generals have started improving. See other signs and symptoms. So this is something that you have to keep in a follow-up after giving a stimulus. So sir said the case, I had a case of my close friend's homeopath who had a carotid artery block and before that he had some block in the artery of the lower limb. At that time, 1 year back, I told him that you will land up with a block in your heart within a year, and he laughed at me as he was not practicing homeopathy in the right manner. When this thing occurred within a year, the doctor told him that he had a double block, 98 and 99 block in the artery, and that he will have to undergo double surgery. The doctor told him, you are in a crisis and we cannot assure you. Then he started thinking, and this man finally was ready to take a single dose homeopathy from me. He was on a 14 allopathic tablet. After I gave him the medicines, he said he would wait for only 1 week. After which he said, come whatever may, I will go for surgery. I will do color Doppler after 1 week. If it does not open, then I will go for surgery. But after the first dose itself, his son came running to me and told me, Uncle, I think my dad is already. I asked how. In this short span of the 4 hour, how? His son said for the first time in 18 days, he picked up the phone and spoke to someone. He also had a paralysis of the right side. This man's concentration was entirely upon his death and disease, and this had been decentralized within a short span of the 4 hour. This itself is an improvement. This man who was completely inside, concentrating on his destruction, the syphilis, his mind is now opening to the world and wants to live. Is getting interested in the things around. This is what only the homeopath can understand, not the allopath. Believe it or not, the next day he called me up and said, I do not know whether dreams interest you. I saw a circus, a man juggling with so many balls. I saw a doll. I was punching it. It would go down and come up. What is the significance of this dream? So Vijayakar says, good, you have not getting any destructive dreams. He was on so many medicines. There was no balance in his biochemistry. I said, I feel it is good dream. So let us wait and watch. After 3 4 days, he rang me up saying he saw another dream. I see a man, eminent politician. I am helping him to construct a bungalow. I said, excellent, this is very good dream. But he said that he has never met any eminent politicians and he is not an architect. I said, anyway, this dream is of construction. He was in the syphilitic state of the despair, destruction, everything lost, decreased blood supply. His mind was now returning to the psychosis. The whole miasm was changing from syphilitic to psychotic. The third dream, he said, after another 3 days, I am with my son in a huge truck in a small lane. I get down there and stand at the side. My son takes the truck for a parking. It is a huge truck and very difficult to park. He has gone to park the truck and he not yet come and I am waiting for him. So this was the anxious dream comes to his mind. So in atherosclerosis, there is a narrowing of the lumen, the motion is obstructed, the dream of son always implies the future. Now he is anxious about his son, the anxiety is coming up, he is returning to the Sura and there is no anguish. I told him the whole miasm is coming back and this is the excellent. So I think though there is no actual indication, but I feel you are improving. He said no doubt because my hand has started moving. The last dream he got was he goes to his clinic and he suddenly finds that there is no lock at the door and he is anxious. What must have happened inside? They must have taken away everything. He was literally telling me his anxiety. This man does not believe or practice Mayasm and he is telling me the return of Mayasm from syphilis to sorry. His body is compelled to tell me. Similarly, the Harrisons and Davidsons are compelled to tell, but if we do not have this thought process, we cannot find. It is mother of homeopathy. There is a student who collects knowledge from me and don't give to anyone. They are psychotic. There are also students who collect knowledge from me and don't understand. They are also psychotic. And there are some who do not understand at all. There are some who say he is talking rubbish, nonsense, and we do not practice homeopathy because it is difficult, idiotic, prank, simple. It is destructive. If he is not practicing homeopathy, he is preventing hundreds of people from taking advantage of homeopathy. Now, the another topic, this was the understanding that whenever you are dealing with some of the pathological conditions and the another criteria to look into follow up that the patient is improving or not, you have to assess a certain dreams if the patient is telling you a dreams. So that is what the assessment of the dreams follow up from the dreams. So you have to understand that the dreams, the some syphilitic dreams, dreams of the bloodshed, dreams of the war, dreams of the destruction are the syphilitic dreams, dreams of the construction, dreams of the money, dreams of the big personality, dreams of some big places. These are the psychotic, and sometimes the patient may develop a dreams of some of the anxious situations in their life. They are soric in nature. So this is what we have to assess that the reversal of miasm happening at the psychological level in a subconscious pattern. And that is what the dreams come. So that do not enter through the dream, but you can understand the miasmatic process happening in the dreams. So another point of learning is the brain. The brain is divided into right side and the left side. It is already known that this left side and right side perform a different function. The coordination of these two sides gives the intelligence. Some have a right dominance more and some have a left dominance more. We also studied in anatomy that the right brain controls the left and the left brain controls the right side. So we are reading with this process. Already we have learned this in the theory of miasm book, the end of my assumption of miasm. Again, we are revising it in our clinical practice. So left brain dominant, that is controlling the right side of the person or a right-handed person. The characteristics are, what do you do with your right hand? The day-to-day activity, feeding the right hand help you to earn money and to go ahead in the life. Such peoples are the analytical, logical, positive, and take firm decisions. The mental quality, the industrious, the right hand help us to work. The right hand help us to do something with the language, like mathematical calculation. In language, everything is logical and certain. Language is expressing your thoughts, what you are thinking at present. This is the boon for human being. Also, the mathematics is again certain. 7 plus 3 has to be a 10. It cannot be 11 or 15 in any part of the world, or it is in a universal. It is not 15 in Brazil and 11 in UK. All this is positivity. There is a force behind it. So these are right-handed and left brain dominant. So they are more money-minded and business-minded. So we have a remedies like calcalia, pulsatilla, apis, bryonia, lycopodium, sulfur. They have a thrust for the business and everything, things and act accordingly, and he express it by speaking. So most left brain dominant remedy are metal and right-sided, and most metals are the right-sided. So this is what the very quick and handy tool of learning search methodology, that whenever you came across a person who having a right-sided affections, or two or three pathology happening in the right sided, you can think of the remedy that is the right sided and having a left brain dominant. Also, the positive remedies are the right sided. We have arsenic, naxomica, chelidonium, camphor, sepia, heparin, and ferrum and lachesis. Ferrum and lachesis are the left sided. Even though positive, they are left-sided. So if we find that the person having a left-sided affections and very positive and firm in their decision, we can think of the remedy like a ferrum, and very manipulative and positive, we can think of remedy like a lachesis. So in left brain dominant people, I have also seen the right side is more susceptible to the disease than the other side. So destruction will also be on the right side. And so right brain dominant will be exactly opposite. So right brain dominant controls the left side of the body. So right brain dominant peoples are the emotional people, sensitive and imaginative peoples. They are more creative, they are uncertain, they have artistic and artistic ability, drawing, musicians, poet, or spiritualistic hypothesis and philosophical background of mind. And sometimes they go into out of control reaction, that is the hysterical, no particular side is affected, or sometimes you can think of the changeable, but those who are more sensitive goes into hysteria. That's why sir has put it into right brain dominant and left sided remedy. So most of left sided remedies are hysterical in nature. The only place where the right and left brain dominant meet in the world is the womb of the female, because it has got a definite certainty. Homeopathy can regulate both sides and make a beautiful balance. There has to be a coordination of the both sides. If the corpus callosum not working, there is no coordination between two brains. There is no sense of right and wrong, and the remedy like anacardium came up. This is the clinical understanding of the sir when the corpus callosum is not working properly. No connection between right and left brain dominance, and that is what the both brain working in a dilemma, and that is what the anacardium comes up, that because the anacardium has the perception that someone is controlling from one side, the angel is controlling from the right side, and the devil is controlling from the whom to follow. So this was the state of anacardium. That's why corpus callosum is not working properly, because there is no connection between the right and left brain. So this is what Sir's clinical understanding. There are many cases where we have find that agenesis of the corpus callosum in the camp cases of Mumbai, Mahabaleshwar, and all over the India. We have seen that Sir has prescribed another remedy, that is a lycopodium, to the cases, and that gives a wonderful result because lycopodium has also a loose connection between right side and left side because of no development of the corpus callosum. So lycopodium cannot understand the side, either a right side or left side. So this is what confusion between right and left side because of the corpus callosum is not working properly. So another remedy came up is in the corpus callosum agenesis is lycopodium. Again, we have seen that the pharum and lachesis are the left-sided because of the increased sensitivity. The pharum is so sensitive that is aggravated even by the slightest noise of the scratching of the paper or cracking of the paper. And lachesis has the increased sensitivity toward the throat, so they are very sensitive toward the touch to the throat and throat pit. So most of the left-sided remedies are the sensitive and the historical remedies. So we have the Argentum nitricum, Asafoetida, Asarum, capsicum, Thina, clematis, crocus, graphitis, creosote, Nicus, phosphorus, sepia, sulfur, and mosca. There are metals who are very oversensitive, and that is the platinum, stannum, zinc, ferrum, and cuprum. These are the left-sided metals. There are historical remedies like Ignatia, Valeriana, Viola odorata, Cimicifuga, Crocus, and Cyclamen. So these are the left-sided remedy. So if the person having a left-sided affections and you will find that the hysterical behavior, you can think of this remedy in the case. This is not a discovery. I am just stimulating your thought process. So much mathematics is there in the human body. The same remedy can be left and right-sided. So this is happening. The lycopodium can also affect on left-sided and lacetin can also affect on right-sided. So it is not the hard and fast rule that every time you came across that it is a left side only. So same remedy can be left-sided and right-sided. A right-sided remedy is nothing but a psychosis, and left-sided remedy are more sensitive, hysterical, are mostly psoric and syphilitic. So here the very concluding part of understanding that most of the right-sided personality are psychotic. So they develop a psychotic disease, and the remedy also is psychotic. And left-sided because of sensitivity, they are psoric, and it is hysterical because of out of control reaction, mostly a syphilitic. So it is also the right side and left side having a miasm also. So we have why lycopodium moves from right to left and why lachesis move from left to right. So this is what we have to understand how lycopodium appear initially the strong, stiff, pretentious, and dictatorial. So he is right sided. But once he is affected, once someone goes near him, he has very poor defense. He becomes very emotional. He is very sensitive with him and he weeps when hanged. So when he is attacked by the disease, he thinks he can fight it. At that time, he is right sided. But as he comes to know that he is not responding to any medication, he becomes very sensitive and emotional and moves from right to left. So this is also the miasm has shifted from right to left. Recognize the lachesis as soon as it is enter your clinic. The lachesis is a very sensitive child. Whenever they enter into clinic, the sensitivity is that he might get hurt, he might get injured, or he might get threatened. So that is what they are trying to come inside with the looking into environment, become so watchful and everything. So a lachesis child will enter always be behind his mother, trying to find out the environment in the room. Is the doctor or any assistant is dangerous? It is like a snake coming out in the hole, and first it will survey when there is no danger outside. So he will come out as the case progresses. They start their sly mischief. Next time when he came, he will directly sit on the table. He knows you are not dangerous to him. So the sensitive, fearful lectures later on become the boss. Then hard on inferior and soft on the Superior. The superior for him is someone whose mind does not understand enough. Inferior is the person on whom he can dominate because they will not do him any harm. So grandmother, mother is inferior to him and the father is superior to him. You can also have a right-sided lechesis, the soric and syphilitic. Lechesis is left-sided. When a lechesis constitution comes to you with a psychotic tumor, it will be on the right-sided. Obviously, the nature then will also be different. This legacy is somewhat like a lycopodium, the quiet, non-talkative, fat, flabby, rounded features, keeping quiet in the huge gathering or the party where everyone is laughing about. He will give a very reserved smile. When you ask him what is the time, he will say exactly 24 hours since yesterday time. He will give such a small petty answer to the joke and make people laugh, but they themselves is very quiet, shy, and do not laugh, not very extroverted as Lachesis is supposed to be. So they are very conscientious and regular, unlike the left-sided Lachesis. This is true of all the drugs. You have to bear this in mind. The same remedy can be sensitive and insensitive, timid and courageous. Keep your mind open and apply the miasm. Don't take it as hard and fast rule. So this is what Sir's guideline and Sir's experience that whenever Sir find that the right-sided remedy or a right-sided affection and having a positive quality, so directly think about the metal remedy. Whenever the person is very positive and strong will, but the side is left-sided, so think it is a ferrum or it is a platina or it is a palladium or it is a cuprum or it is a lactasis. So this is what Sir is thinking in this pattern. So this is what Sir's experience and that is guide us. So the science is an art and you have to apply your intelligence and you have to create some beautiful cures. If legacy is going from left to right in terms of the disease, cure has to follow from right to left. So if you remember the propodal plate and the central axis, legacy will develop from the right to left. The first right side of the legacy will develop in the worm and then the left. Lycoid will be exactly the opposite. So if disease is going from left to right, the embryological growth should be from right to left, exactly opposite. So morphogenetic gradient will flow from right to left. This is determined by the genes. If the father is psychotic dominant and mother is soric recessive, then it will be a right-sided. So this is what the dominant miasm from the parents. One very useful fact which I would like to demonstrate is that there was a news in the Times of India dated on the 12th Feb 2001. The front page news that proteins are responsible for everything. The gene map leads expert to unexpected features. This was the headline. The scientists working on the genomics have said that their findings made it clear from being a blueprint. The human genetic code is only a guidepost. The true direction for what makes a human being lies not in the letter of the code, but what the body does with that code. That means everyone has a genetic code. We have about more than 32,000 genes, but all are not active. They have found few interesting tidbits. The future research says lies in the protein which these genes synthesize that makes up the bulk and not so much in the genes. Every genetic code is expressing itself in the form of protein. It is not only genes that are responsible, but also its protein that makes up the people. This scientific field is known as proteomics. Proteomics. They are now trying to go to the conclusion that protein in the body gives rise to whatever you are and what disease you are going to understand, what the human being is going to suffer from. Is this a new discovery? This is what Hahnemann has said 200 years back. Assess the mental makeup and the general makeup and the structure and the miasm, all of which is due to the protein. After 10 or 20 years further down the line, they say that the whole therapeutic line will change and doctor will be assessing the protein which gives rise to the structure and nature of the person to repair the disease. But We have already been given this tool and are using it. None of the homeopath came forward to say this is not protein, this is the homeopathy. So this is what we have to right now. The recent study has shown that in the therapeutic world, in the allopathic also, they said that the individualistic therapeutic modality has to be applied so that we can treat the human in a better way. So that is what happening right now also. So this is what 20 years back Dr. Vijayakar has written this, that one fine day everything comes in this way. So this is what again the sir is far ahead of the times, so he can understand that this will happen in the future. Again, this was the side we have looked into. Now we have to look into the physiognomy of the face. So sir has given the idea that by looking into face, we also conclude some miasm of the patient as well as certain quality of the person. So by looking into this physiognomy, so sir has given us the faces. So there are the three type of the faces. One is the vital face, one is the mental face, and one is the motive face. So the motive face is a querish face, a prominent cheek indicate a strong, positive, courageous, leader-like personality. The mental face, the oval or the pear-shaped face with a tapering chin indicate the conscientious, scientific or artistic personality. And the vital face, it is a rounded, chubby face indicating the cheerfulness, frivolous persons, and with a good oratory power. This is the case said by one of the delegates from the Cochin, Kerala, southern India. Delegate Dr. Vijayakar and the faculty member had been in the Cochin for a seminar. Just before a seminar, my brother met with an accident. He was rushed to the hospital and the CT scan was taken. There was no major injury to the brain, but he had a left hemosynus for which he was under observation for the 48 hours in the neurology ICU. After 48 hours, when he was brought out, he complained that he could not see anything with his right eye. His vision was totally lost. This was one of the biggest hospitals in the Kochi. Three eminent ophthalmologists had examined his eyes and they failed to see anything. They gave us some medicines and asked us to report after 48 hours. Sorry. I was not convinced with this approach and I took my brother to another ophthalmologist who diagnosed it as a case of traumatic optic nerve injury. He suggested that my brother be put on tapering doses of the steroid and the chances of recovery are very less as it was already 6 days since he had sustained the injury. He might recover a bit of his vision, but he will have to live with this scotoma. At that time, Dr. Vijayakar was come to there, so I thought, why not take advantage of him? It was actually a boon in disguise. After receiving him at the airport, I was just waiting to narrate my brother's case because that was at the top of my mind. So the conversation went on to my brother's injury as well as his present state of condition. They were not in a relaxed state of a mind as something had happened at airport. The projector had been left back at Sahara Airport and they were anxious about it. In midst of that, I discussed my brother's case with Dr. Vijayakar. I said that it looks like he is phosphorus. Can I give him phosphorus? Will it help him? The most important point wherein he ruled out phosphorus was the side of injury. He had sustained an injury in the right eye. He at once ruled out phosphorus. I was amazed, wonderstruck. Why cannot it be phosphorus? From the airport to the hotel, once I described him my brother's nature, he confirmed that he could not be phosphorus, but can be ferrum phos. See, the side is very important. The phosphorus is a left-sided, ferrum phos is a right-sided remedy. So this is what very important, but can be a ferrum phos. Though he had not seen or met my brother, he was only later that night when he visited me at my house and met my brother. He confirmed with just a few points and asked me to give Ferrum first. I gave my brother Ferrum first at 11 p.m. that night. The next day morning, I just called up my brother from the seminar hall to find out how he is. He told me that he had recovered his vision by 50%. We were quite skeptical that with this 50% vision, will he be in a position to ride his bike? Now he is roaming around in the whole town in the middle of the night under the full glare of the oncoming vehicle without any difficulty, and his vision has improved by 95%. So this is what something that we have to keep in mind. So Dr. Vijayakar says that this sort of knowledge, what we learn in morning, help you become more and more confidence. I do not say just look at the sight. You need to have a lot of weapon in your hand. He had already given him phosphorus, but there was no improvement. Then I asked him which side is the injury. He said it is the right sided. So I said phosphorus is wrong. He must be a phenom phos. I asked him, is your brother bold or strong? This was the confirmatory question. So that delegates replied that yes, sir, recently there is a riot in Cochin between the Hindu and Muslim, and where we are staying in the Muslim dominated area. So our temple is in the Muslim dominating area. He went there all alone without any fear, in spite of the whole family telling him not to go. So this is what a very strong personality with the phosphorus kind of personality. So they advise the so you have seen an element of phosphorus in him, but the courage means that there is a metallic element in him. Otherwise, he would not have got hurt on the right side. As the disease would come from within or without, also, the side prone to the disease will be the side which is weak in him. Very important. So, as the disease come from within or without, also, the side prone to the disease will be the side which is weak in him. So the person who is weak in that side, their side has to be affected. So for example, if lipopodium patient, you will observe if he met with an accident, though he falls on left side, the major fracture sustained will be on the right hand side and vice versa. So body is trying to defend by sacrificing the particular part. If the right-sided man is always going to use the right side for defending himself, then right side goes on expressing disease and vice versa. So this is what very important. When they are in the sensitive or soric state, they are more right-sided. When they go to the psychotic state, they are more on the left-sided. This is one lycopodium experience. So this is what we are concluding here for today's topic, that the side is most important, the facial features is most important, and the how to assess the follow-up, it is also important. So whenever we apply this knowledge in our practice, then and then we can get the right remedy. In spite of giving the remedy which is phosphorus, in this case the phosphorus is indicated, but after giving phosphorus is no better, but the strong personality, then the ailment remains same, but the another ailment is added, that is paraphos. So this is what you have to take into considerations of this process. So I will show you the motive, mental, and the vital pictures so that you will have a little idea that how it looks like. So we'll continue this. I will show you. I have searched in my laptop the photo of that. See, look at this face. This face looks oval shape, tapering chin, everything in alignment and aphoric in nature. So this is called as a mental face. Look at this. The stubby cheek, little bit rounded, everything is extra, the earring is extra, lipsticks and everything, the hair color. So this is something called as a psychotic. So most of the actors or actress they adapt the psychotic features. And look at this face. Something is a squarish, a bony structure, a sharp jaw lines, and this is something called as a syphilitic picture. So you will have the idea by looking into face that how the person is which miasm. So this is what I am here to share with you. So hope you all have a great idea and understanding of Sir's thought process, and Sir is giving a good idea of how to assess these things in a little way. So we conclude our day today, and thank you so much for being with us in the Readers Club. We will continue our journey from tomorrow. Thank you all. Thank you.